There is another aspect to all of this, Disha. The United Residents Association of Nurses have now written to the Mumbai civic body, Mr. Pravin Pardeshi, raising the issues and the concerns faced by nurses across hospitals in Mumbai, especially those who are treating COVID-19 patients. They have demanded adequate protective gear for the nurses who are working in the front line, and they feel that this is a basic requirement which has not been taken care of adequately. Disha, coming to you on this point, and also additionally, of course, like you said, that asymptomatic patients can be carriers. Hospitals need to take precautions for that. Were there lapses in following protocols? Because these are now concerns raised by the nurses' body for hospitals across Mumbai, not specifically one of them, and also the nurses from Kerala, a bulk of them being from there. The Kerala government has also written to the Maharashtra government on this.
Well, definitely when this walkout incident really came to light, of course, the United Nurses of Association, after speaking to nurses across the hospitals here in Mumbai, be it private or government, they have penned down certain issues and demands that they want the government to really fulfill for the safety of these nurses. If you talk about issues, basic issues like protective gears, that is not really adequate in most of the civic hospitals and even private hospitals is what the letter reads. They say that the protective gears provided for the nursing staff are not adequate despite being exposed to the patients for longest. So here they are demanding that the hospital must ensure enough availability of at least protective gears for the nursing staff. Secondly, they also say that the adequate nutritious food is not provided to the nursing staff at the hospital, because here the nursing staff actually works for more than 12 to 14 hours a day. So that is something that they should really take care of. Thirdly, nurses, lack of facilities for nurses who are at quarantined at hospitals, like beds, mattresses, and proper food is not being provided to them. So hospitals where nurses are being quarantined, the letter reads that not enough basic facilities are given to them. So that also should be properly dealt with. Another important aspect here that the letter really points out is the fact that nurses who are bringing out hospital lapses and treating COVID-19 patients are harassed and scolded by the hospital management. So here they are demanding that hospitals shouldn't harass the nurses who are highlighting the shortcomings of the hospital in treating COVID-19 patients. And most of all, last important factor, it says that most of the hospitals, they are not really quarantining the nurses who are directly coming in contact with the COVID-19 patient, even knowingly in certain cases. So here definitely the spread of the infection goes rapidly, and they are demanding that the nurses should be quarantined, they should be home quarantined, or at least should be kept in isolation if they are coming in direct contact with the COVID-19 patient. So these are certain issues and demand that nurses have actually written to the government and asked them for their health care, for their safety and concern.
Yes, and this is important also because about 30 private hospitals in Mumbai are now catering to COVID-19 patients. So obviously there will be a big demand for specific protective gear and precautions. There must be enough awareness among the medical staff as well. Protocols must be strictly adhered to. Perhaps there was a certain lapse in this particular case in Wockhardt Hospital, due to which a huge number of medical staff, nurses and doctors have got infected. Disha, thanks for joining us. We also bring in now the other